Welcome to Behind the Sports Medicine Podcast, the podcast that pulls back the curtain on the evolving world of sports science. I'm Andrew Rizza, an athlete trainer with decades of experience in professional, collegiate, and high school sports.
And I'm Cameron Roth, an orthopedic surgeon and a consultant for the Chicago White Sox.
In each episode, we'll explore the real-world challenges and opportunities facing today's human performance professionals.
Our hands-on experience is transforming sports medicine and breaking barriers through innovation and teamwork. So we're here at the 2025 NATA Convention in Orlando. We have the pleasure of having Dr. Frances Meredith. She's a physician trained originally in primary care and infectious disease, and now she's been in the functional medicine space for many years. So we're happy to have her. Thank you. Welcome to Behind the Sports Medicine Podcast.
Thank you, Cameron. Good morning. Nice to be with you.
Absolutely. So can you tell us a little bit more about what functional medicine is and how that fits into our healthcare dynamic?
Functional medicine, the way I think about it, as opposed to dysfunctional medicine, which I was a part of for over 20 years, is root cause medicine. It looks to peel back the onion of the roots of disease. It asks why, and it honors the patient in terms of it brings their intuitions, their understanding, it uncovers their understanding of their timeline, and we often find aha moments that uncover multiple root causes of whether it's, depression, fatigue, irritable bowel syndrome. Probably 80% of what I see is autoimmunity, where the body's turned against itself. So we look at it as root cause medicine. So I'm always looking for what brought you to the table.
Now,
peeling the onion.
Let's break that down a little bit. So in medicine, as a physician, when the patients come into clinic, we do a history, we do a physical, maybe you do some imaging. In orthopedic surgery, obviously, we do imaging. Maybe you do some imaging, maybe some blood work, and then you come to what's called a differential diagnosis, maybe a bunch of reasons why something is going on, and then you assess the patient, provide a one-line summary of what you think is going on, and then a plan on how to treat them. So that's what we're taught in medical school.
Right.
And that's, quote, Western medicine. What in functional medicine differs from that algorithm?
Just about everything.
Perfect.
So I learned lots in traditional allopathic medicine. I had to unlearn quite a bit from traditional allopathic medicine, namely dogma and skepticism and not trusting the patient. We're taught not to trust the patient, not to ask them for intuition. So the history, for me, I have a 2-hour intake. So I have a lot of time with my patient. And a lot of these folks have been to multiple physicians. They've not been heard. They've gotten either right in their face or the quiet meta message of, oh, honey, it's all in your head. And so they come away with no confidence in themselves. So our intake is much longer. The history is much longer. And I'm diving deep into, I have to find out about their childhood. I'm looking for adverse childhood events, ACEs. I'm looking for traumas. I'm looking for everything. Because if I don't get at those root causes, someone might get themselves 80% better, but they'll never reach 100% of their potential unless they deal with those. So the history is big. It's different in that I feel like Western medicine, you get a list of differential diagnoses to explain a symptom. Here's a symptom, let's label it. That's quick jump to let's label it, and then they're off and running. And that closes the scope of curiosity right then and there. So people come with a whole bunch of symptoms. So my training in functional medicine, but more my time doing it and what I've learned from my patients is that, frankly, I need to just sit back and listen and let my brain process the patterns. And often they've seen patterns themselves. So I'm not trying to match one symptom with one disease. I'm seeing that one symptom can be caused by multiple things. Multiple things can this one underlying root cause, say mold or a concussion, can manifest in multiple different symptoms. So this one symptom, one diagnosis doesn't work optimally for most patients.
Our live series at the NATA Convention is sponsored by Met1 Technologies. Looking for innovation in orthopedics? Meet the only U.S.-based, Latin-owned manufacturer originally focused on spinal implants, now leading the way in upper and lower extremity solutions. They've just expanded their portfolio with the newly launched Fortis Distal Radius plating system, 510K cleared and designed for next-level performance. This isn't just progress, it's representation, precision, and results all in one. Today's episode is sponsored by Get Raw, a potent antioxidant blend made with all raw organic ingredients. The Get Raw ginger turmeric formulation is 200 to 300 times more bioavailable to the human body. Documented benefits include decreased inflammation, improved digestion, immunity, cognition, and more. Get healthy, get well, get raw, the organic wellness shot. There's a commonly known fact among orthopedic surgeons that on average, it takes an orthopedic surgeon 18 seconds to interrupt the patient.
Yes.
As you're going through the history.
We're faster. We're 13. I just did it. I just interrupted you.
Perfect.
Internal medicine doctors.
That's fascinating to me.
13 seconds.
How long do you allow your patients to answer your first history question before either asking a follow-up or redirecting them somewhere else? Now in your functional medicine space.
It's much longer. I can't give you a time, but I'm actively self-managing that.
Longer than 18 seconds.
Minutes, right?
Your people are quick at, okay, I know what it is, but instead, like for us in the athletic training space, I interrupted you, sorry, but in the athletic training space, in physical medicine space,
yes,
I tend to, as I've gotten older and more curious about the patient, I try to catalog everything and listen, like you were mentioning, and then let them go through everything. And even though I might say to myself, well, I think I know exactly what this is, I'm putting it in the back.
Me too.
You know,
yes.
I'm storing that, letting them discuss what they want to discuss with me and tell me what they're going through. Physical exam, and then say, okay, this is what I think we need to look at. So it's almost
and does
seems
this
like
feel right to you?
Correct.
Right.
So it sounds like
Yes.
that's what you're describing as
Yes.
being your practice and what it's important to do with your patient.
Yes. My practice in particular, I would call it a heart-centered practice because before I let the patient go into their story, I invite them to be an expert at the table. So, hey, say you're my patient. You come in, I say, hey, I don't know if you have any experience with functional medicine, but this is going to feel very different. First of all, I'm not Dr. Meredith, I'm Frances. We're on a first name basis because I'm not the expert in your body. You are.
Yeah.
So you're an equal expert at this table. Me, the patient, my health coach, which doesn't begin to explain her qualifications of what she brings to the table, but the three of us are equal experts. So I also tell them right at the beginning, I know that you have been treated like it's all in your head and you've not been asked for your intuition. I must have it. I must have your intuition. I will never roll my eyes, and it will often direct where we're going. Like, hey, I just have this instinct. We haven't barked up this tree, whatever it is, like head trauma, mold, heavy metals, whatever they are bringing to the table intuition-wise, I honor it and will follow it.
Tell us a little bit more about your health team. You mentioned you have a health coach.
Yes.
Who else works with you in your space, and how do they contribute to the patient care?
Well, within Stribling Springs Wellness, which is my wellness practice in Raleigh, I have a health coach. Her name is Clarissa. She is trained by Institute of Functional Medicine. She is a yogi. She's a Reiki master. She's an entheogenic coach, so she knows about plant medicine. So she has all of the spirit, mind, body connection piece. She's an I-Rest yoga meditation teacher. So she can meet that patient where they are and take them to the next level of connecting this with this and how this affects the body. I work with her intimately. She's the other half of my brain. All I need to do is say one word and she knows exactly what I want. And then I have an administrative support. Her name is Kathy, and she is actually a blossoming health coach herself. So she, like the first voice that answers people, is just makes them feel supported and cared for and heard.
What's the demographic that you see, like the type of patient that you see or tend to get more of in your practice?
I would say I see 80% women, 20% men. Some of those men, their wives have told them they needed to come.
That's great.
Men often
Former patients?
Yes,
yeah, okay.
yes. So word of mouth, word of mouth, we don't have to advertise because we have, oh, hey, my friend saw how much better she felt on bioidentical hormone replacement, and look, she lost 20 pounds. What is she doing? I want some of that.
Yeah.
I want some of what she's having.
Yeah,
Right.
yeah.
So a lot of friends send friends, family members bring family members. So we've got folks who, a lot of them who are, some of them are desperate. I mean,
Yeah.
they felt fatigued, brain fog, not felt well for years.
Has the medical system failed them, and that's why they end up with you?
Yes.
Okay.
They're not heard.
Yeah.
And they're pigeonholed within
The system.
18 seconds,
Yeah.
right? They're pigeonholed as, oh, this is psychosomatic.
Yeah.
Here,
So
let me
you mentioned brain fog.
Yeah.
Is that going down the road of concussion?
Well, that's
Are you
certainly
finding
a
that?
piece.
Are you finding that it's something else? Maybe they've been dismissed. Oh, you're fine. That you don't have anything wrong with you, but they're constantly having this cognitive
Yes, it's frequent.
trouble or fogginess during the day that they don't understand what's going on, and those are the people you're seeing.
Often, I would say that's a super common symptom that's always part of the symptom package.
Okay.
But yes, that's a piece in the concussion space, the autoimmune space, big
Okay.
time. So anything that puts your brain on fire, brain inflammation, you're going to feel brain fog.
Yeah.
If your hormones are not right, if you're a 45-year-old guy who's been in the military and had his head hit and he's not making testosterone anymore because his head's impacted, he's going to have brain fog.
Yeah.
If you're a 50-year-old woman with Hashimoto's that's active because for whatever root causes, she's going to have brain fog
Gotcha.
due to neuroinflammation. So, but things like concussion, heavy metals, there's so many things that impact our energizer bunnies, our mitochondria.
Yeah.
So that's like the final common pathway I feel in brain fog.
Yeah.
What's slowing down your mitochondria?
Are your treatment pathways less focused on medications and more focused on lifestyle modifications, exercise, nutrition, mindfulness? Where do you focus that energy?
There's a time and a place for pharma. So I am not anti-pharma. I am pro less pharma. So I'm an MD. I can prescribe medications when need be. I prefer lifestyle and food first and movement first. And here's where Clarissa comes in to see what, meditation might be right for you. Reiki might be right for you. The tools are different for different people. So we always come at it food and lifestyle first and movement first. And then there's a time and a place for medications. If I have someone who's everything shifted when she hit perimenopause and menopause, she's on hormone. My first goal is I need to make you an expert in hormones now because what you were taught was wrong. So I'm not going to shove hormones down anyone's throat. I want to quickly educate her and then quickly get her hormones back up to optimal. So at least we can wipe that part off. Great. Now my brain's working well from a hormonal perspective. Now what's left? Mm-hmm. So we peel the onion.
Are you seeing younger populations that have been referred to you for post-traumatic injury, head injury, concussion, trouble with recovery, kind of hit a brick wall, nobody's paying attention, same type of thing? Do you see younger high school athletes, you see collegiate athletes, or just people in everyday life?
So in my functional medicine practice, Dribbling Springs Wellness, those patients tend to be folks that I'm peeling back the onion of why they are feeling the way they are now. Say autoimmunity. We peel it back and, gluten's a problem. You've got mold in your house. That needs to go. But the linchpin, the pivot in their lifetime was a motor vehicle accident 15 years ago. Then we're off and running on, well, all right, now let's check your cerebellum, your vagus nerve, all of the pieces that let's do the real brain rehab that needs to happen from chronic. But to your question about youngers, the younger folks I see in my functional medicine practice, almost all of them have autoimmunity.
Okay.
Now, within my concussion doctor, which is where we're blasting out an acute intervention supplement blend, we are getting lots and lots of interest from that population that, hey, I've hit my head 3 times in the soccer field and I can't do this again. Yeah. So we now have a way to be able to address those metabolic shifts.
What do you see from your training, either as an MD in your previous life as a primary care and infectious disease doc or now as a functional medicine doc, that helps with concussion recovery?
Thinking broadly, not treating every patient as the same. My son's path showed me that greatly. Like, his eyes were fine. It was his vagus nerve and his cerebellum that needed help. And he had opened up a big can of whoop ass of autoimmunity. And so I think bringing to the concussion space, thinking broadly, knowing that it is not just a brain injury, it becomes a whole body injury because the brain communicates, you've got you've got the vagus nerve telling everything else, something is very wrong up here, and the whole body hears it loud and clear. So I'm thinking in terms of whole body with functional medicine, so that allows me to think that way with concussion. And I'm also realizing that the brain inflammation that takes place, I'm sure you guys have seen this. You see mood shifts. You see changes in family dynamics, changes in sleep, unable to tolerate stress. And that knocks them off their path in life. Whatever their passion is, they're knocked off. So thinking that way and helping to figure out what are the pieces that knocked you off your path. Is it your vagus nerve needs help? Oh, you have food sensitivities now that we need to deal with. You need cerebellar retraining or visual retraining. So we've got connections with all the people in these spaces to be able to do the functional neurology rehab.
What other physicians or healthcare providers do you collaborate with to refer or to consult for patients?
So we collaborate with functional neurologists. So they tend to be chiropractors. They're usually very outside the box thinkers. They're not just pop and crack people. They've moved into functional neurology. So there's a big practice in Raleigh that we collaborate with, CFNC, and they do a lot of concussion rehab. There are chiropractors that have gotten themselves really broadly thinking and smart in the field, knowing that they have stepped into the functional medicine space. So I collaborate with them as well. I also collaborate with neurofeedback specialists. My co-founder with my concussion doctor is Dr. Robert Barrick, and he's been in the concussion space for years with his patients and with neurofeedback. So often neurofeedback can be a really helpful tool in the whole package. It's never just one thing. So it's a multi-modality approach, team approach, depending on what parts of your system went out of balance.
Yeah, we talk about this quite often, and being an athletic trainer for almost 30 years, concussion, the evolution of concussion and the way you assess it, diagnose it, treat it, rehabilitate it, get somebody back to their life has changed 10 plus times.
Yes.
We have seen that the multimodal approach has been very paramount in the way that we treat these athletes. It's knowing the athlete or knowing the patient and how you plug and play certain things in their life to get them back to what they need. It's not putting someone in a dark room anymore,
right,
pulling them away from activity, not letting them do exercise. Our goal now is to get them back to normal life as quickly as we can and control symptoms, but listen to what's happening to them daily in order to treat them appropriately to get them back on track. And that could be, I want you to go to bed at your normal time. I want you to wake up without an alarm clock. I want you to eat whatever you want to eat during the day. I want you to make sure that you can read and cognitively think the way you need to do so to operate. And if something does bother you, we pull it back. And I think that approach has helped a lot of athletes progress. But then if we run into issues with the quote-unquote, air quote, Western medicine, we then have alternative medicines like you had alluded to, which are helping. Now, my question to you is, what preventative measures can people take, if there is any, to help reduce the chances of having a neurological episode or a concussive episode for them to be safer at whatever they're doing in life?
Well, that's where we brought Concussion 911 to the table. So our product is not a product to me. This is my passion. We watched concussion rip through my family. My son had a concussion back in 2023, and it knocked him off his professional soccer career. Happy to say he's back on it. He's playing with Spokane Velocity now.
Fantastic.
But I was already moving into the concussion space as I would peel the onion back and often find a head trauma as that linchpin. So when my son had his concussion, I had to get smart really fast because he got the traditional medicine answer that you've spoken about.
Yeah.
So hundreds of hours of research, and I couldn't believe no one was doing this. Like, let's put together all of the pieces that have science behind them, all the individual ingredients that have science behind them to help with the metabolic shifts that happen within minutes. So that's what we're trying to do, and we're now seeing that it's helping people get back on track much faster. So little bit of background on the metabolism, because you got to know it. It's actually very simple. So when your brain gets hit, the glucose transporters stop working immediately.
Correct.
So you give that kid a Gatorade on the sidelines, the brain does not know what to do with that glucose because its preferred energy substrate is no longer accessible. So ketones are the backup generator. So we have BHB ketones in our product that immediately provide the brain with energy, bring that back up. So when the brain shuts down, you've got neuroinflammation rising, toxins rising. Those things are the things that are going to lead to all of the classic concussion symptoms you guys know. So if we can catch them right at the point of impact, or as fast as we can, to bring the energy source, bring energy back to the brain, bring the brain back online, then it's regular work of daily business it can do.
So you're trying to slow down the metabolic cascade that's happening.
Yes.
Because the influx or change of potassium and calcium rushing
Yes.
in and out of the cell.
Yes, absolutely. So there's things in here that stabilize those nerve channels. There's anti-inflammatories that you've heard of. There's omega-3 fish oil and vitamin D and curcumin from turmeric. And then there's things that help to stabilize those ion potentials, right? So you've got magnesium in there, there's vitamin C in there, those things help. And then things like acetylcholine and acetylcysteine to help with get the toxins out. So we're seeing our patient testimonials, we're right at the front end here. Our patient testimonials are impressive of getting people back to function much faster. So our goal is to have this in every athlete's backpack, every AT's, toolkit.
Yeah.
But I'm guessing you guys have probably hit your head at some point in the past. So we're all going to do it again. It's not a matter of if, it's when. So ultimately, I feel like we all need a small fire extinguisher in our house, which I have, my son has. All of us are at risk of hitting our head. So if we have a small fire extinguisher, then we can quickly leap to it, use the fire extinguisher in the kitchen before it spreads to the whole house and becomes a total body injury. And that's what we're after.
We were talking earlier about the biopsychosocial model of medicine. And in orthopedics, we're known to be, you see a broken bone, I need to fix it.
That's what what we called you guys in internal medicine.
Yeah.
Bone broke me fixed.
Bone broke me fixed. It's very classic, and I think it still continues to this day. But hopefully some of us, and including myself as I continue to gain experience, are working with the biopsychosocial model of medicine. And how do you think functional medicine in your profession and the people you work with fits into that model?
Well, there are so many things that support wellness of a human, and we don't live in isolation. Isolation is one of the top killers, and we saw that with COVID, right? So with my patients, frankly, we treat them like family because they feel like family, and that's important. What is their social network? What is their support system? What are the stressors that they have? How can we help to support them? And all of those pieces, isolation, living in a fear mindset, it affects our genetics. We turn our genes on and off by methylation every second of the day. Fear, click. Genes turn on, genes turn off. So if we can calm that mind-body axis, help them, guide them in terms of building their human support net, that's a linchpin in terms of healing.
And us in the orthopedic surgery discipline and athletic training and physical therapists can use you as a resource, but also use the knowledge that it's not just an ankle sprain, it's not just a fractured distal radius, it can possibly be more. And if we use all aspects of the whole model, we can provide the best, most comprehensive care for people.
Yes, and it takes a team. That takes a team to do that.
And if we were so lucky, we would all have functional med docs or functional med professionals or health coaches or functional neurologists around us. How do we advocate for more people in the functional medicine space?
The word's spreading, and it's not spreading through the traditional medicine community. So whenever I have the opportunity to collaborate with a colleague, whenever I have someone who's coming into me who feels they weren't quite listened to, maybe by their primary care doctor or their traditional MD doc, I always tell them, I want to bring them along for the ride. I don't want to step on their toes, but we might have to agree to disagree on some things, but may I please send them our notes? And usually my patients say yes. So I'm thinking of one GI doc in particular who, when he found out that I had switched, he said, oh, she went to the dark side. She's just going to take all your money and you won't get better. So a year later, my patient who had like bad belly symptoms from small intestinal bacterial overgrowth, she was all better. She had healed herself. I don't do the work. They do the work. I just help translate and give them a path. She went back to her doctor and said, I don't think this is the dark side. And now he's come to see the light. Now he's sending people. So it takes a while for those wheels to turn, but it's grassroots. I think it's grassroots. I mean, patients need to spread the word and demand
patient testimonials, what we call level 5 anecdotal evidence.
Yes.
I've seen it personally in training. As I was telling you, I took care of some patients at the Brigham. We had a functional neurologist who we would send them to, and they would come back with incredible results. And I'm still looking for some functional med docs in Arizona who can be very helpful. We interviewed Dr. Megan Garcia-Webb, who's a weight loss medicine MD specialist in Boston, and she's absolutely a treasure trove of knowledge on weight loss medicine. What are your thoughts on the rise in medical weight loss? Or do you have any?
Oh, yes, I have lots of thoughts. That's often a piece of why people come to me as well.
You're welcome to get on your soapbox.
It's about root cause. It's about asking why.
Yeah.
So I talk in metaphors all the time with my patients. They probably get sick of it. But I'm always looking for, what are your weight usual suspects, right? First, when did it happen? Right? When did all of a sudden your body not listen to what you were trying to tell it to do? And so then we're digging back into, well, what was going on? Oh, huge stressor. My mom was in the hospital. My kid hit his head. Or food started not agreeing with me. So we want to ask why. So I'm always looking for weight. Inflammation is always my top. If you're inflamed, you can't lose weight. And the doctor will say, why don't you just move more and eat less? And the woman knows, I'm eating like a bird, and I am moving, maybe too much. So you've got inflammation, you've got stress-induced cortisol. It's like taking 10 milligrams of prednisone every day. Good luck losing weight. Hormones out of whack. I'm thinking perimenopause, right, and into menopause. So fleshing out what are their weight usual suspects and going at them is, I love being able to give the patient, like, I think these are your weight usual suspects. Let's address these. Let's give you the positive reinforcement of, oh, we addressed these things and look, 20 pounds disappeared. Great. Now we don't have to go looking for weight loss medication or looking for the GLPs or whatever. Not that they're evil. I think they have a huge place. But I like to be able to give the patient the power of, now they know. Now the power's in their hands. They know what brought them to the table.
If there was someone that's listening that's out there that doesn't understand the space that you work in or what you do, or thinks it's voodoo, what would you tell them? Or what would be one thing you would tell them to do to understand what you do to help your patients better?
I think a good resource is Institute for Functional Medicine. That's where I train. They do a really good job on their website of explaining what is functional medicine. My website is striblingsprings.com, striblingspringswellness.com, and there's a lot of that information there that explains how we think, what we do, and also makes it very clear that the patient is a welcome expert at the table. And that's necessary for healing. Excellent. They need to know it.
Yeah, that was great.
Yeah, it's a great lesson for all of us. We really appreciate your time. It was fun meeting you.
Yes, so fun.
Talking and learning more about
Yeah,
functional medicine. So we look forward to communicating and collaborating in the future. So thanks so much.
Yeah. Fabulous. Thanks for having me.
Awesome. Yeah, of course.
Thanks for coming on.
All right.
Thanks.
That was awesome. Thanks.
Thanks for listening to Behind the Sports Medicine Podcast. Follow us on social media and check out our website.
The information shared on this podcast is for educational and informational purposes only and is not intended as medical advice. Please consult a licensed healthcare provider for guidance related to your specific situation. We'll see you next week.